Okay. Thank you very much for joining us with the expert panel. And I would like to start with Dr. Sudarsam. Uh, so first, like I would like to know, because this, I think this is kind of a discussion is new to construction industry, and then you are coming from a different background than ours, and why exactly we need to give attention to this issue, and how serious this issue actually. And as the national director of dengue control unit, what has been taken so far and what we need to take, like in as an introductory note, sir, over to you.
As Chandana, you correctly told that construction, when come to health and safety, mainly accidents. But with this, there are some hidden issues. Construction sites. I will come in with a case study, some case. Recently, we have completed one of the mosquito control special programs in Western Province and Batticaloa and Kalbune district. Then what we do is we go to the houses and places and look for breeding places, and then we eliminate them and we calculate them for our evaluation. So what we have, that we have visited about 500 construction sites. Out of that, almost half the construction sites are having potential or actual mosquito breeding places. And out of the construction sites, almost 1 in 10 sites is having a breeding place with active larvae. That is, mosquitoes are actively breeding there. So dengue fever is coming from a mosquito. That is a viral disease, and the mosquito is the one transmitting the disease from the man to another person. So with there's a very high risk of getting dengue in this area. Mainly that, as Chandana told, that water is part and parcel of the construction. There are so many that the water collection will be there, or some, or the construction site, for example, a concrete slab or somewhere, or some other utensil that you are using heavy, that the tools, concrete mixtures, maybe collecting water. So, and also sometimes that you are making a pit for this, for the lift elevator. That is a very good breeding place, the collection of water. So with that, dengue can happen. The other thing is that these construction workers, they are active people, and that they will work in there, and even a minor fever or something like that, they will ignore it. So that is the danger. So if that when the person is having dengue, is not getting adequate rest and attention, it will lead to death. So what will happen is there will be an issue. Other thing what we have seen is when there is a 1 or 2 cases, then the mosquito will transmit, and there will be building up of a cluster of cases. It will not stay at the construction site. What will happen is it will go beyond that. That actually that we have seen that in some places that this is spreading into the perimeter, other villages, other households around construction site, and construction site may be a focal point for a large outbreak in an area. So because of that, that is very much important. Otherwise, what will happen that when the people are getting sick, you will not be able to do the proper job there. So similarly, COVID also having the same problem, that you have to work there, you are getting together, there will be you will pay the attention minimally for these personal protective measures. So with that, you can have. We had practically seen that construction sites are having large outbreaks of COVID. The other issue is once it come there, once it established there, to control it, to eliminate that from that place is very difficult. It will take longer time. So what will happen when, because of these illnesses, this infectious disease, COVID and dengue-like illnesses, in the construction, the people's health will be affected, and also the health of the construction also affected, because that you will not be able to do the proper job at the right time. and it will affect the industry, profits, everything, and your targets. So because of that, other thing is that when you come into dengue, even COVID, that at least there is a vaccine, but COVID, the dengue, you are having a still the vaccine side trial level. You don't have that treatment, but the best thing is to prevention. There are many ways you can prevent it if you pay the proper attention and if you monitor that. That is the most important thing. You can, it's the cheapest way that what you can attend. So because of that, the getting the attention and getting aware and keeping it in mind and working is very important. We can prevent dengue and go ahead with the regular your business. Thank you.
Thank you, sir. So you said like that doctors always say that prevention is better than cure. I think so. You have mentioned that prevention is the most important thing, but Mr. Tilak, you are coming from a construction background and you are leading one of the most leading construction companies in the country as well. Is it possible to do that? Another thing is what Dr. Sudat highlighted is that this construction site is not like you can't take it in isolation. It is part of the community as well. So one breeding ground in the construction site can make an outbreak in the community itself. So like, can we do that at the site? Can we prevent it?
Thank you, Dr. Chandana, for giving this opportunity. If I directly address your question, yes, it is possible, but there are cases that we have to address in different ways. Let me explain this. Basically, construction mentality is building. Right, we are always working on building large elements, and physically we can see the progress is coming up. So whether it is a multi-story building or a road project or a water project, so different any other project, we have mentality of getting the progress and building the element in different ways. So that is one challenge. On the other hand, COVID and dengue they are caused by tiny, maybe a tiny mosquito or virus. So handling this virus and the mosquito together with building two different cases for the construction people. So that is a challenge. Of course, it is possible, but it is a challenge. Let me explain this way. Like, in the construction industry in Sri Lanka, if you take a majority of workers, they are coming from very rural area. I would say, I cannot use that word, but for the sake of explaining this thing, I will have to use the word, let's say they are from lower class people, right? Sometimes we have seen a trend that they are coming from the village after the, season when they don't have their cultivation, they come to Colombo and work in a construction project. And then again, they go back and do their farming activities, right? So on the other hand, there is no regular or maybe training institutes to form formal construction workers in Sri Lanka. There can be situations in other countries, but in our case, we have to face that situation in different. So another fact is, that is fact number one. Fact number two is, Sri Lanka is continuously subjected to raining and dry season. And all of a sudden these days also we experience, today it is raining, tomorrow it is not raining. So because of that, you always get wet conditions and water spots in construction projects. Another fact I just want to inform that not like in garment industry or not like in factory environment, construction industry is totally in open ground, right? When you start the project, uh, people have to heavily work on excavation and then finding materials, taking material, and then bringing them. So nature of construction industry is, dealing with big elements, big activities, and difficult activities. So whereas dengue and COVID is something minor in the sense size wise. They are very small insects or very small viruses. So the challenge is for construction, once again, I want to tell management is to how to, balance these two equation in current scenario. So for that, of course, if I answer to your question in order to elaborate more, if one company is having a proper dengue management plan, of course, in ISO, if we implement ISO things, it says that you have to plan first, and then PDCA cycle, you have to plan, do, act, and then continuously monitor this and improve. If you have a proper management plan for dengue and proper management plan for COVID, of course, it is possible. But I would say that not 100%. 100% is near, it's the perfection. But when you come to a site, let's say if you have a proper management plan, if you have continuously monitored this, and if you have achieved result, of course, out of many places, there can be one place that dengue breeding place, dengue mosquitoes can be found, but provided that management plan is there and actively engage in that management plan, I would say that we can achieve it. Yes.
Okay, thank you very much, Mr. Tilak, about that positive note. And then, so you have mentioned about this management plans, importance of having routine reviews of what you are doing. And then Professor Ranjit Disanayake, as the chairman of the Green Building Council, as well as the secretary to the Ministry of Rural Infrastructure, I would like to ask from you, sir. So then I know that the buildings, so then as Mr. Tilak said, it's about buildings. So you are in a process of making the buildings green. So can you integrate this monitoring and reviewing process also to the that reviewing process of making the building green? And also about, I know that you are you're in a process of integrating disaster resilience also into this green building evaluation. So can you make it that also part?
Thank you, Chandana. Let me start from the kind of beginning of how this green building concept is adapted into the construction industry. So we look for a kind of slot analysis in the construction sector. When we do the slot analysis, one of our aim is to make sure that the building which we constructed has a less impact on the environment, where land, water, and indoor environment and so forth. So then when you do the slot analysis, we understand mainly there are weakness and threats. Right? Among that is the one is the weakness is we get a lot of accident, and the health, of course, now it is coming as you said. And the other one is raw material consumption and energy and so forth. So then based on that, what the greener building concept is to do the construction what we do, but end of the day, we will more target about the sustainable building, where it will reduce the water consumption, energy, and make sure that the indoor environment and use land, use so forth. But now I understand that, of course, we consider about the indoor environment that is part of health. And again, the making sure that the segregate of the material, better water management and so forth. So then, if you really want to go for the greener building, as you said that there won't be places for the dengue mosquitoes. Right? Now, another point is that when you come to as you said that because recently we included the DRR into the greener concept. Why we specially included this, but that was there. But we understand that later, but is it enough that we have included? For example, we may be able to come up with the highest rating, platinum. If the day flood come, earthquake come, if the whole structure will be flooded or damaged, I mean, there's no point of having the platinum because it is subject. Likewise, no point of making the platinum structure, the workers get sick due to the dengue. Therefore, as the day by day statics of the dengue is increasing, and as a doctor correctly said that he understand that most of the construction sites are vulnerable places. Therefore, we have to revisit the rating tool and see whether we can give the more emphasis on prevention of the dengue, as well as, of course, now as it today during last 2 years the COVID is there. So that the future we have to make sure that that part also, right? Likewise, so that that also should include. I can remember day before yesterday I visited to a factory. Yeah, factory workers are partly isolated. They are having their own tea separately and meal and so forth. Likewise, we have to think about that one, because if this continue, the COVID, dengue also coming time to time. So we have to include that into our process of making sure that this is the, I think, way forward. I think as a kind of conclusion of this, what our discussion right now here, we can think about integration of the COVID as well as the dengue into the greener building practices. With that, I would like to conclude my speech. I might leave some soon because of another function is starting. So thank you, Chandan, again.
Thank you very much, sir, for attending to the session with your busy schedule. I know that many things going on today. And in the construction industry, what we talk about is like engineering hierarchy of controls. So we talk about removing the hazard to coming to the lowest level of PPE. But I think in the medical field, you have a different kind of approach covering all the aspects. So I would like to move to Dr. Nimalka Panilhetty about asking this integrated vector management practices, where as far as I understand, it's a kind of a comprehensive approach of covering all the aspects of this, all the aspects. So, Madam, could you please explain us about this integrated vector management practice, as well as some case studies as an examples?
Yes, thank you, Chandana. Now, I think we all have some understanding about the occurrence of dengue in the construction sites. Being a major public health problem affecting all the ages, dengue has recently recognized as a disease, rather an occupational disease in construction industry, as disclosed by our hospital surveillance data and also entomological surveillance data. We all know that construction sites are vast and diverse, and it is not easy to have zero breeding places. Nevertheless, we have several options to prevent our staff, occupational the employees free from contracting dengue. Why we say integrated vector approach for dengue? It is because by one single method, we can't control dengue in community or in an industrial area. We have to apply several methods synergistically by different sectors simultaneously, because this dengue fever affects all the sectors. So it is a common problem, and the common problems have a shared role with others. Uh, Dengue, we know that the dengue mosquito breeds in clear water, not essentially as clean as the drinking water, in clear water that is collected and stored in the construction sites. There are potential breeding places which might get water after rain and be a good mosquito breeding places. So we have to consider first the source reduction activities. It doesn't cost us anything. We only have to inspect our premises and get rid of all the potential breeding places, dry and wet. So we all know that I don't have to mention what are the items that could collect water. So that is called source reduction activities. So basically, it is environmental management. It is not the broad sense of environment, the environment in the working place or even at home. So environmental management is aimed at reducing all the breeding places to prevent man-mosquito contact. We can achieve that by two methods. One is environmental modification. So that means we have to think of modification methods as we design in the design phase. We have to design in such a way that the buildings that we make buildings for some other to occupy. So the lifestyle of the person occupied will be affected by the way it is designed. So in the design phase, we can consider about environmental modification methods like installing plastic shell tanks instead of open tanks, installing a screen to prevent mosquitoes coming in. So those are a bit costly, but those are long lasting. So we can incorporate those things also building. And having the roof cutter. Roof cutter has been, it is implicated as a major threat for dengue transmission. So if we can design the roof cutters in such a way with good material that would not allow puddles to collect mosquito breeding. So that sort of things we can consider. And building without roof cutters also is another option. So those things need good research and practice. That is environmental modification, which is long lasting and costly. Then there is another thing, environmental manipulation. It is simply what we do routinely. We inspect the breeding places and remove by proper solid waste management. Maybe that we can put some fish to some water collectors. We can keep them covered. That sort of simple things are manipulative methods. So again, there are so many breeding places that we cannot simply remove. For those things, we have to apply chemicals. Maybe that you have to liaise with the medical officer of health and PHIs to identify what are the chemicals that could be used in what concentration and so on. There are biological methods as well, like BTA and other. Those things are available in the market on liberal use. So there is another option, legal option. I think that fears most of us when someone comes for inspection and finding fault with you and file a case against you. So that is one of the horrible things we face in construction industry. We generally hope to educate the construction industry. We have had several webinars also for the constructors coordinated by CEDA. We try to educate the main officers and change their behavior through education. So that is what we are aiming at. But for repetitive offenses, there are some some cases where they have resolved to legal actions. We will forget about that. And intersectoral coordination also is very much important. So maybe that these large areas can be divided into several zones, and the safety officer or a team can inspect at least once a week the different zones, and they can eliminate all the breeding places so that a threat won't be there for the employees. Because as it was mentioned, these employees come from faraway areas, and during the once the mosquito bites and introduce the virus into the these workers, when they get fever, they would go back to their homes and take the virus with them, and it will be propagated, culminating in local outbreaks in their local areas. So and also if they have fever, that is also another control method. If they have fever, we have to inform the medical officer of health area so that they would come and see what are the breeding places and what actions to be there, what chemicals to be used, and so on. So I think I have enlightened you on the integration of different methods for vector control. Thank you.
Thank you, madam. And then we can go for the case studies probably in the next round. And then so in the integrated vector control method, which madam explained, she has mentioned about the environmental management methods, chemical methods, biological and biochemical methods. So then when we can go for more innovations and then more engineering approaches in these three. And when we discuss about these three, I think Professor Aditya Alvis might be the best person to ask and get some expert opinion. He has joined with us via Zoom. So, like, would you mind sharing us the like experiences you have and then you have come across on these approaches, sir?
Thank you, Chandana. Thank you, Chandana, and happy to see Dr. Sudat there. But maybe I'll just put in a few thoughts coming from an earlier experience, I must add. But now with a little bit more technology, hopefully we can work on. I just very quickly. Am I visible on the screen?
Yes, sir. You are.
PowerPoint?
Yes, sir.
Right. Of course, we used to say that sometimes a small when you're small, you can't make an impact, and mosquito is completely the opposite that. And there was this comment: if you think you are too small to have an impact, try going to bed with a mosquito in the room. This was mentioned by Anita Roddick. So just an example of how strong something simple can also be, and we have this. So I'm just looking at now we are in the probably when you see we look at research and from the I mean my on this dengue it comes back to the association with COSTI, and we were trying to work with the dengue control unit and also environmental police, and I just bring an example of nanotechnology in. So the probably when you look at these examples of bimodal seasonality, and we are probably in the end of one phase with respect to dengue, but we continuously hear that sometimes these things are changing. So April to June and October, December, this is coming from this most recent SLAS conference. There were several research published on dengue, and this is one. But I also present at Eastern University in the research sessions held a couple of days back, and there was this interesting presentation from the research on the and I heard Sudat mentioning about the Eastern province, some of the surveys. So in this, it was interesting to see this prevalence and biomass for this, and they were talking about two aspects on two varieties. I think Aedes aegypti and this albopictus in this particular abstract. And what was mentioning was about the chemicals becoming resistance. That is perhaps a challenge. And basically taking two types, even in your construction site, the indoor and outdoor kind of thing, the building inside and the outside. And the solutions, I mean, appear to be like, okay, go after the breeding habitats and then look at space spraying. And usually then you have another type solutions that we have. But what about innovation too, right? And here the answers were that I'm not sure how they did the DDT part of the work, but the DDP carbamate resistance, and then their malathion, which is still used in, was partially resistant or susceptible to be resistant as well. And the only opportunity for us was so the point, are we building resistance, and then another variety comes and we not apply these chemicals. So do we have a different option? So so chemical method was mentioned, and biochemical method, biological method was mentioned. Perhaps the biological method may be more appropriate, but from chemical, interesting things that are kind of opportunity space is like use of nanotechnology and nanomaterials like silver nanomaterials. And this is green chemistry. So use of silver nanomaterials has been proven for both the larvae as well as the pupae, and different LC50 values exist. So how do we promote it? Now, this is where I'm, again, perhaps more in net connection between the medical authorities and other teams to come in. And Sri Lanka should have a roadmap saying that, okay, we are going to bring this down by this much, and how do we factor in? And the next part, I'm just connecting that to something that we it's not. So today, the Wolbachia, maybe the University of Kalani has been in the front in this one, and even recently now we have this the box design being asked from society, and so that's a biological. It's quite well known sterile insect control technique. So perhaps these things, how do we scale it up and ensure the solutions reaches out? It is for that purpose that we came up with the technology-driven management. So SIDA has given techniques or rather mandatory identification of amount of money to be put in for construction site. And why not use part of that money or the allocation? We know how much this money cost overruns happen in the construction sector. There's a lot of money just goes, but the technology is not very well utilized in some areas. And perhaps this is one area. Now, it's good to see that dengue has been taken as an occupational disease for the construction industry. So, so what is the technology driven? What we identified was there's so much of opportunity. So this is just putting after the learning from the COVID, the 3T technique of test, trace, and tackle, right? And very quickly. So what we came up given was discussion was from the COSTI at one point was the dengue early warning system, and basically making use of the information. Right. Today it is much more stronger and it's much more possible in real time, and connecting environmental police into the equation. And if you have two patients identified in testing, and then seeing if they are students, if they're children, look at the school from two different addresses and so on. I think it's very well now looked into, but somehow are they supporting with the real-time control at the National Dengue Control System with quality decision making. And then the objective was to have a dashboard and and the digitizing the information and making the models and ensuring the support is there. So if you get data and if you have a cluster or a hotspot may be just two patients from one location, and then there must be something wrong, and very quickly tackling that. That's where the environmental police was to come. And we were not able to get the Grama Sevaka in, or I mean, like maybe something to think about. How do we, university or research can help the Ministry of Health in this regard in coming up the system. And the other ones were like ensuring that you have the adequate GIS facility and have the dashboard for data dissemination and decision making. And this entomology plus entomological plus the epidemiological approach, you have the typical things that are happening, but they come onto the same platform and very quickly move on. So SOPs, the techniques, the new techniques may be coming, and of course to be supported by mathematical modeling, so that I mean, like, let's say we are on the October, December, the bimodal on the curve, and okay, get ready for the next one. How do we better off with this information of today? And we know there were several mobile platforms were generated from Sri Lanka. Some Malaysians ones came, and I mean, we were having also on our phones, but we knew it didn't move on very much. Now that's something. How do we really ensure that this is done with a much more focused roadmap? So bringing the technology of information technology, innovation, and then a roadmap, and then ensuring that we have a solution and we control them and so on. So the control group, what to do, and the coordinating group, these were the kind of like the elements that we built in, and also the layout of the dashboard was given. These things are now quite common, but somehow or other with a time-bound, activity-oriented, action-oriented, results measured, and the typical quality cycle of PDCA. And that was what we thought must be necessary to get in. So you can target the construction sector, and the construction industry can join in by supporting the health sector to achieve some of the part of it, because there is the different technologies are involved in getting this thing. So working in partnership rather than getting worried and being on one end of it saying, okay, they're checking on us. No, becoming more of a partner to ensure the solution. So you can see this, the history of it. So there's another fellow chemical engineer here is actually on this. This is again a SLA's submission from this year on this modeling and connected to the weather. And so because Subaya Larif is now into these weather aspects and modeling, and we know climate change is also having issues on the dengue. So let me, that's it. So what I think is, as per chemicals, we look at this traditional and we may have this ultra small, ultra low sprays, but can we look at different techniques, but promoting more the biological techniques and ensuring that and in the construction site, there was again a construction site action identified in this recent last research, homebound, how do you look at the spaces and so on. So I suppose we must monitor and connect the research and mobilize the parties, and we should have a clear roadmap saying 2 years down the line that we are going to bring these numbers down, and so on. And maybe the technology is to be scaled up. So at the moment, that is another issue. The scaled up to ensure that answers are there and a rapid response mechanism. So that's the kind of thinking that we were having at the time in supporting the health authorities in this. Thank you.
Thank you very much, sir. Like, it's good to see that many things are happening behind the scenes, and then what you have mentioned is like further highlights the fourth point, which Dr. Nimalka highlighted here, the intersectoral collaboration and then the health education. So with that, I would like to move to a very good old friend of mine, Dr. Lahiru, who is like whatever happening in the research field or whatever happening in the higher levels, we have to take it to the ground levels. Like as Mr. Tilak said, the construction workers might be coming from different social, educational, we can call them marginalized group of people. So the language they might be understanding might be different, right? So in that case, what do you think? Like, I know that you like, let me, if like Dr. Lairu is a very special person, where he starts his day with a note on dengue in his Facebook. Like if I read some of his notes, like මේකත් පිපුරුවත් මුල් දින 6ට ඩෙන්ගිය සැක රෝගීන් 1096යි කොළඹ ගොතුටුව කොළොන්නාව බත්තර මුල් හෝමාගම අවදාන. So he says, හෙල්මට් දාන් ඉව්වත් මදුරුව කනවා. කුස්සිය තනියු ඔබේ බිරිඳ රැකගන්න අදම මදුරු විකර්ශකයක් ආලේප කරන්න ඩෙන්ගු භයානකයි. So he starts his day with the note of educating public. So with that, Dr. Lahiru, so you are a specialist in community empowerment and education. So how to take this message down to the construction workers and safeguarding them?
Thank you, Chandra, for the opportunity and the kind introduction. As you correctly said, now, if we take the construction workers as a cohort, they have very special characteristics. Now, as you mentioned earlier, they are from a comparatively low socioeconomic background. That's the first thing. Second thing, they come from different parts of the island, and they have the potential to take back the disease to different parts of the island from the metropolitan areas. And the third one is they have very sort of special behavioral patterns. Now, they resist something. If we tell them to do something, they might resist it, right? And they will take much more time to adapt to a new behavior. So these kinds of special characteristics are there in the construction worker community. So when you communicate a message to a such unique cohort, a unique group of people, especially in regarding health, you have to have some constructs or some plan to take your message to the construction workers. Now, in case of dengue, you have to have, first you have to tell them and see how they perceive their susceptibility, right? How vulnerable are the construction workers, how they perceive the threat, right? So if we are not communicating the vulnerability of them to them, right, so they will not hear our message. That's the first thing, right? When it comes to dengue, you must communicate to them that they are vulnerable, because they most of the time they do work in the out environment. They are exposed to the bites of the dengue mosquito. They work during the peak biting hours of the dengue mosquito, especially in the daytime, right? So you must convey the susceptibility of them before giving them a message. The second thing is perceived severity. How severe is the disease? Now, some of the people might think that this is just a simple fever, right? You might have fever, you take some paracetamol and you have some rest, you have some liquids, and then that's it. But there are now dengue is sort of a wide spectrum disease where you have a very simple fever to a very severe dengue hemorrhagic fever and dengue shock syndrome. So you have a wide spectrum. Now, if you can't understand the severity of the disease, then you can't give a message to the construction workers. So your message should contain some lines that this disease is severe, right? So you have to communicate to them that this is a severe disease. So perceived severity is a must. Then the third point would be perceived barriers. Now, we are telling different kinds of methodologies, different kinds of interventions for the workers to adopt, but they have their own barriers. Sort of, they can't. Now we are, for example, now we are telling apply mosquito repellents to the exposed parts of the body. Now, as constructors and as the civil engineering fraternity, you very well know that it's very hard when you work in the out environment. It's very hard to apply a mosquito repellent. So there are barriers, right? So you have to understand the barriers. What are the barriers that construction workers are facing? The next one is perceived benefit. Now, people don't agree to an intervention, or people don't follow an intervention or any modality of prevention if they don't see any benefit to them, right? So you sort of, you have to communicate that this not only benefits you, but benefits your entire community, your colleagues who are working in the construction industry, your family, at your village, right? So perceived benefits should be there. So when you communicate on these lines, you give them the severity, you communicate the message that this is, you are also susceptible, you give them the benefits, and you understand their barriers. If you construct your message in a such a way, then it's very easier to communicate the messages, especially dengue, not only dengue, even the COVID prevention messages to a community who has very comparatively very little health literacy.
Thank you very much, Dr. Lahiru. And I would like to again move to Dr. Sudat. Sir, I would like to ask the final part of this integrated vector management approach, the law enforcement. So Dr. Lahiru talk about this importance of making them aware, and then this having a more hands-on approach than having laws and regulations. So what would be the most effective ways like to move forward?
Yes, law enforcement is there, laws are there. There's an act for the prevention of mosquito breeding places, and it is under revision now to make it more applicable. And also there are some other laws and regulations. But the thing is then environmental policies there to monitor and see. Everything is there, and also our public health inspectors are empowered to charge if a person is defaulting. It is there, yes. But the main thing is that this type of public health issue cannot be controlled solely by law. That it is should be that the person, people, as Lahiru told, that people should feel that this will be benefited for us, then they will grab it and do it. But there will be some people that is repeated defaulters, and yes, then that law is necessary. So that law is, it is available. So one thing is that premises cannot be maintained with mosquito breeding places. So if there's a mosquito breeding places in a place, the person who occupies that place, the person who owns that place, or the person who is in charge of that place, maybe office building or something like that, is responsible for that. And if he don't take the appropriate measures, he is liable to be penalized. So that is there available, but we take this measure as the last resort if the somebody is habitually or repeatedly doing that. So that we should use that very carefully and very sparingly. In addition to that, there are some facilitating laws and regulations. For example, that the CEDA has initiated and pioneered and helped us to give the instructions and making it facilitate that if some construct that if you are that preparing a BOQ for a construction, you can make some allocation, or you can quote, or you can estimate some expenses for this vector control activities. For example, to make some modification or something like that, or may that buy the pesticides, spraying the things, chemicals for these things, that you can cost it and you can charge it for that. So that the provisions are there. So I think that the laws available is adequate. The most, but important, I reiterate that the people should feel that this is our responsibility. This will be benefited ourselves as well as the other part of the community. So we should do that. That there should be a very good engagement. Then only that it will be helpful.
Thank you very much, sir. I think that should be the way forward, like rather than like asking you to follow the strict regulations and guidelines. But with that, I would like to move to Dr. Mr. Tilak. So I think it's part and parcel of building a culture among the workers as well as senior management, and collaborating with the other organizations as well. So in that case, I think that is the section that you are heading in your company. So what is your experience so far building a safety culture, not only occupational health and safety, but also other aspects like dengue and COVID as well?
I think we are coming to solution part. Of course, end of the day, we have to build the culture. Otherwise, we will not be able to deliver results. Time to time, we will be able to implement so many programs, but unless otherwise we have a solid culture, we will not be able to sustain our results. So as you rightly mentioned, let me hit this point in this way, like, we when you take a company or a project, you have different level of people. Let's say top management is there, then the middle management, or let's call them as frontliners who directly face this situation at the site, project management level. Then the third level is the workers and people who really implement this situation, these construction activities. So to get the attention of top management is very important of building a safety culture or the culture for this kind of activities. So for that, of course, we need to understand a couple of things. As Dr. Ahiru mentioned, we need to understand our barriers and also the benefits and also the repercussions we need to understand. So the barriers right now are, we seriously face, I believe that Dr. Sudatta and the team will take this message forward now. If I take this pandemic situation, I mean, after many years, we experience this kind of a pandemic situation in Sri Lanka right now. So we have construction projects right now which are operated, which are not designed for this kind of pandemic situation. Now, there are many construction projects which are being implemented at this stage. Of course, we will have future projects also, which are for which we will tender, right? So if I take the projects which are being executed right now, so the contractor has the responsibility to prevent and avoid all these situations. So the problem is in our condition of contracts or our BOQ level or our agreement level, I'm telling the real truth of this situation, right? There is no provision. Of course, they will give time escalations. Of course, they will give because of pandemic, one project we were given 1 month, let's say, extension, right? But there is no case for us to claim for the activities which we have lost or for the overhead which we have lost. No company will be, I mean, people like ICCO, Margao, Sunken, bigger companies who were at this level of, can be tolerated, who can be tolerated these things, can tolerate. But many other small companies or medium level contractors, of course, they cannot tolerate this kind of things. So what will happen end of the day? So they will have to take the progress. They will have to earn the profit. Of course, they will have to earn something to pay workers. So they will continue to do working without considering all those dengue practices or COVID practices or whatever it is. So this is the truth, real truth. So that is one part. I mean, the existing projects. For future also, I mean, there are many projects which are in the pipeline, right? So I feel now itself, construction industry and the health sector should join together and make special provisions for this kind of pandemic situations, as well as, agreement level, we should have special provisions to say that if there is a pandemic situation comes, or if there is a dengue, let's say dengue, there are some projects, as Dr. Nimarka mentioned. Of course, I have also gone to many of your lectures and learned a lot of things from them. So if there is a dengue, what do you call, outbreak happen in a project, if suppose if they want to close the project and clean this thing and avoid this thing and then come up with a favorable environment, there should be a provision there. Otherwise, they can't do it. Construction industry, people think that because of a bigger value, they have bigger margins. No, it's not the case. So they work hard and earn. That's the different story. So to get the top management attention and to get the top management culture towards this, right? I believe at the BOK level and condition of contract level, and also at the agreement level, we need to make some adjustments. Of course, there are SIDA guidelines and SIDA this thing, but the involvement, I want to say sadly, and the relevance is not that much. So we need to be very practical and make some adjustments by getting this experience into the future projects. That is one part. Middle management, of course, top management say that there is something like this. You should make your focus to this and close the site and make all provisions. Of course, the top middle management will listen to that. That is one part. Then I will come to, because of the time constraint, the last level of this, that is construction workers building their culture. Of course, you will have to have a solid management plan. For that, everyone was talking about, they talk about this. But let me take one example. So as Dr. Nimalka mentioned, you will have to have a zoning system for each and every project. This is one method, of course, we implemented with the support of Dengue Control Unit. So you have to have zoning system. So you zone the project, and then after zoning, practically you will have to have 5 or 6 zones. Then after zoning this, you will have to make some in-charge officers for each zone together with some workers. So then you will have to categorize your breeding places. You will have to educate workers on these breeding places, so that they understand that, of course, when there is a polythene sheet, or when there is a rubber, what do you call, tire, or when there is a water closet or whatever, when there is a hole, something, those places are highly vulnerable for breeding places. So that kind of education has to be given to these zone in charge and workers. Then, of course, each worker and the zone in charge has to every day inspect the place and then clear that there is no breeding places in my zone. Then they will have to do some documentation work. Of course, training and development is very much important. After training, continuous training is required, and you will have to identify gaps. That is the mechanism I am telling all these PDA cycle, as Dr. Ajit, Professor Ajit mentioned. So you will have to train people. You will have to find out whether this system is working or not. Then, of course, you will have to monitor, and then you will have to improve the situation day by day. If you are doing this machine, if you are implementing this machine continuously, of course, the culture will be developed, provided that, this top management commitment and middle-level management commitment is there. Otherwise, workers will not continue. They will drop they will stop the machine. So, having said that, I just want to mention that this discussion is extremely important, because we all face a severe pandemic situation we are facing right now. Dengue situation is also the same similar situation, but attention has not gone to dengue because of COVID. But if you take the real statistics, it is equally dangerous as COVID. So when you take both together, Dr. Sudat, I believe that we have to have a serious discussion among all the stakeholders and give a paper to SIDA to implement certain conditions, to adjust certain conditions, so that contractor will be able to understand this situation and then work towards this. So that if that can be taken place, I believe this discussion will move forward to a different dimension in this country.
Thank you very much, Mr. Tilak. I think rather than like arguing that my side is correct, your side is wrong, like you came to the middle and then proposed a workable solution. Like I really like that highlighting the continuous improvement with the PDCA cycle, where in construction, if you planning for quality improvements, that is where we need to move on. And with that, because of the time constraints, I think we can open up the the discussion to some questions. Is there any questions from the audience? So then the panel can take 1 or 2 questions from you.
As a lean practitioner and as a civil engineer, I would like to be in this panel, in this audience. My question is that safety is first. We can see on boards when we go to the site, but these kind of discussion are very much important to bring the message to from top to bottom. So I would like to know what are the guidelines available from the people who are making the guideline, I mean from the act level. So what we can see to prevent the small people in the ground level in the construction in terms of safety, especially for this dengue and COVID preventions.
Thank you very much, Kokila.
For dengue prevention in construction sites, we have been working very closely with SIDA. So apart from educating the higher level and middle level officers, we have prepared guidelines and advertised in our website as to how to manage site free of breeding. I think further to Mr. Tilak's presentation, there is a very big gap on transmitting knowledge to the middle level workers there. For example, when we visit the sites and have informal discussions with a series of safety officers, they like to receive knowledge and transform to for good practice. Unfortunately, in the system of getting approval for a plan in the for a construction, there is no provision for them to meet the MOH or visit the MOH and get information that we discussed for them to implement in their construction site once they start the operation. So they really don't. There are many occasions that they come to know about maintaining and getting information from National Dengue Control Unit when we visit the site. So it is very sad because it is there are so many construction going on in major medical office of health areas. So if in the chain of getting approval, once you submit the plan to the local government, and until you get approval, if the MOH could be connected in between, so that the constructor or the developer visit the MOH and get the information about how to keep the environmental management and also application of larvicides, chemicals, and other this where to buy them, and those information are not available to them unless we go and tell them. So there is a very sad situation. So we have been having discussions with the Ministry of Construction also to give us a time to amend this approval process with the incorporation of medical officer of health. And sadly, we have seen that most of the construction sites adopt fogging fumigation as the mainstay of reducing vector. So it is really sad. It will kill only the flying mosquitoes, which would carry the virus from sick person to another. But nevertheless, we have seen that a lot of breeding places are inside with larvae, which are not killed by fumigation. So we have to implement synergistically several approaches. So this the information and all the information and provisions have to be delivered to the construction sites in a more practical and very approachable manner. So that's important.
Chan, let me add a few lines to that question. Thank you for the question. I think in 2018, if I'm not mistaken, there was a collaborative effort with the Ministry of Construction and Industries, as well as SIDA and Major Constructors Association and National Dengue Control Unit and Ministry of Health to produce a joint circular. In this circular, we have identified several provisions, like you have to have a health and safety officer in the construction site who take care of dengue and other communicable diseases. And then you have to have some provisions within your BOQ for the larvicides and mosquito control methods. Then they have identified the different levels of construction and how this law should be, how this circular should be applied. But as Dr. Nimalka said, on the practical terms, it is very difficult if we are not connected with the relevant medical officer of health area office to implement these interventions. So that is the missing link. I think as constructors and civil engineering fraternity with the medical fraternity, we have to link this through the medical officer of health, because he is the regional or the local public health practitioner who has the provisions under the law, as well as who have the practical provisions to implement such preventative actions. So that is the missing link. I think we together, I think in future can definitely apply those kind of provisions to that circular to make it more actionable. There are circulars, but the actionability is comparatively less. That's the issue.
Thank you, Dr. Lahir. There is
I want to add a little more.
Please,
and actually, the government has taken this serious. So recently, the cabinet decision has been taken that multi-sectoral approach should be implemented for the dengue control. And in future, there will be more intersectoral collaborative activities as well as some guidance coming up with strengthening this dengue control.
Thank you, sir. So there is a question from the audience, and the question is from Samuel Abidin Alara, if I have pronounced correctly. He or she asks, can the force majeure clause be explored for the pandemic situation of the construction industry? I think Mr. Tilak might be the best person to answer that question.
Yeah, I think he is trying to address about the same thing what we are talking about right now. Of course, this should come from, I don't know whether it is from the government regulation point of view, it should come from an act, or it should come from a circular, or maybe what kind of a document should be released for this kind of situation. So definitely there should be some provisions in case there are some losses or whatever happen, then only the people will activate and come forward and take actions against this. Question is very valid, and that is the discussion that we have to conduct. And to add to what Dr. Sudat and the rest of the team what they were talking about, and now I feel document wise or regulations wise, this is not only applicable to this situation, applicable to many other things also. It is very difficult to find the right circular right now, because there are many circulars on top of another circular, right? To be very frank, let's say, I will tell you noise level, simple example, noise level. There are many maximum level of noise is given in many areas. Environmental authority given one level. Colombo Municipal Council is given another level, right? There is no consistency in our circulars and laws also. So that is why people will not understand. Now, as you rightly mentioned, if we understand the repercussion and if we understand the real gravity of that people will react, right? So when you take now itself, now the COVID situation, we know that it is a new thing for us, but still now the consistency which has to be maintained on information which are coming from various levels is very important for this, very important. So I believe when you come to COVID and dengue management system, when you develop it in future, we need to have a consistent communication from both ways, from company or implementer point of view, as well as from the government and the policymakers level also. This discussion should continue. Immediately we have to take some actions. At the same time, we need to have a very open dialogue between both parties.
Thank you very much, Mrs. Tilak. I think as the final round, is there anything to be added from the expert panel? So then otherwise can conclude the session.
One point, Chandan, I think now few practical points which we have observed when we are going to the construction sites for the inspections. I think Mr. Tilak, we had also collaboratively worked. Now, there are some avenues for you to educate your workforce. For example, now the toolbox meeting, which you have in every day morning, I suppose. Now, this is a very good platform for you to educate your workers on dengue as well as other communicable diseases such as COVID-19. What are the precautions? What are the ramifications if you get dengue fever, right? And then, as Mr. Tilak said, zonation is very important, but zonation without a proper responsibility and sustainability it is not sustainable if you do like that. So every zone must have a responsible person. And these diseases like dengue and COVID both have fever, right? So it is very important that at the entrances, so at the entrance to each zone, you keep a fever surveillance or a fever register book where you can identify the people who are carrying the disease, right? So that will save you from outbreak, right? It will be limited to very few people if there's a few outbreak, right? So these kind of practical approaches, I think we have to look into. So basically it's a risk assessment. We are talking about the resilient building structures. It's basically a risk assessment where you assess your risk, where you assess your hazard, your vulnerability, as well as your capacity.
Okay, thank you very much, Dr. Lahiru. Mr. Tilak.
Yeah, one more thing I will have to add. I feel that the threat in the future is not from big animals. Threat in the future will be from small insects, right? So I feel that this pandemic, this thing will be continued in different forms. You know, I had experience in Singapore when the SARS was coming. I was there working in a construction project. And of course, initially they were frightened and they did not know what to do. But slowly they adopted very good management plan for SARS. Entire Singapore was closed and they managed it very well. The day they opened the Singapore was a festival day for them. And likewise, in Sri Lanka also, we will be able to do that if we all join together and implement a proper plan and execute that into get results as we discuss. So threat from insects has to be identified in future, and now itself we will have to act.
Thank you very much, Mr. Tilak. I think I would like to end with what Dr. Sudat said. I think prevention is better than cure. Before this small insects making a big disaster, so we have to stop it at the very minor micro level. So I would like to thank all the panelists, Dr. Sudat Samaravira, Professor Ranjit Disanayaka, Professor Ajit Dialvis, I hope sir, you are still there, and Dr. Nimalka Pannila Hetty, and Mr. Tilak Jayatunga and Dr. Lahiru Kodituaku. Thank you very much. and then we will take a small break, and then we will move into the presentations after that. Thank you.